Mr. Durbin, aye. Mrs. Murray, aye. Mr. Reed of Nevada, aye. Mr. Schumer, aye. Ms. Stabenow, aye. Mr. Begich, aye.
Are there any senators in the chamber wishing to vote or to change their vote? Seeing none on this vote, the yeas are 89, the nays are 1. The nomination is confirmed. Under the previous order, the motion to reconsider is considered made and laid upon the table. The President will be immediately notified of the Senate's action, and the Senate will resume legislative session. The Senator from Michigan.
Thank you, Madam President. As we come back into session this evening and on to September, as Chair of the Agriculture Committee, I have one message for colleagues in the House of Representatives, for the Speaker, for the Republican leadership, and that is we need a farm bill now. We have 20 days until the farm bill expires. Only 20 days. And if that happens, if the Republican leadership doesn't work with us to pass a 5-year farm bill, they're going to reset the clock for rural America all the way back to 1949. Because if the farm bill expires, we go back to Depression-era policies that include government planning restrictions and expensive price supports. Absolutely unacceptable. Some of these policies even reference prices from before World War I. This would be terrible for our family farmers and ranchers. It would throw the markets into complete disarray. There's no reason that this should be allowed to happen. The full Senate has worked together and passed a bipartisan farm bill. The House Agriculture Committee worked together and passed a bipartisan farm bill. It's time for the House to complete its work. The House Republican leadership has refused to let the bipartisan bill come up for a vote. Despite our best efforts and speaking with colleagues and working together over the August break to try to come up with a way to get this done, we find ourselves in a position now where our only opportunity is for the House to take up the bill that was passed by their committee and get this done. I have never seen a situation where a farm bill, and this is my fourth one that I've been involved with, comes out of committee on a bipartisan basis, and then the House won't take it up, which is exactly where we are. Instead, they sent us a so-called disaster relief bill that unfortunately only helps some livestock producers with their drought this year. It does nothing for the rest of the nation's farmers who've been hurt so badly this year by frost and freezes. And our farm bill does that. In fact, our farm bill is better for livestock. It's a permanent livestock disaster assistance program with a better structure and support that was sent by the House of Representatives. A full 5-year farm bill gives much more comprehensive disaster assistance to livestock producers and to other farmers who have been hit. Other farmers who've watched their crops wither under the forgiving sun want to know that not only will we have a 5-year policy in place, but that we're going to strengthen crop insurance, which really is the backbone of supporting farmers in these kinds of situations. We strengthen crop insurance and expand it so more farmers can have access to risk management tools on their farms. Madam President, that was the #1 issue that we heard in all of our hearings, was to strengthen crop insurance. And that's what we did. And that's one of the reasons we need to get a 5-year farm bill done. And I'm looking at my colleague from Iowa, the distinguished senator who chaired the committee before me, and I know that he shares the same feeling that I do, that we need to get this bill done in the House of Representatives. We know that our farm bill also fixes dairy support so dairies don't go through what they went through in 2009 when thousands of farms went bankrupt. Frankly, not changing the policy for dairy is a disaster waiting to happen. And so we need to get the farm bill done. We also reform programs. We know that we have ended direct payments and altogether 4 different subsidies, saving $15 billion while strengthening crop insurance. We streamline and address duplication, crack down on waste, fraud, and abuse, and in the end, our bill saves $23 billion for taxpayers, $23 billion to pay down the debt. The only real deficit reform we passed in the United States Senate was our farm bill that we worked on together. Unbelievably, the House Republican leadership still stands in the way of passing our bipartisan bill or their own committee bipartisan bill. Now, on Wednesday, we're going to see thousands of farmers around the country coming to Washington with a simple message. We need a farm bill now. Members are going to have visits from farmers and ranchers from their state. House members will be hearing from members in their districts, and they have one simple message. Those farmers know that when there's work to be done, you don't put it off till another day, not if you're going to be successful as a farmer. And we shouldn't be kicking the can down the road either. They can't say, I don't want to harvest my crops right now. I think I'll do it in a few months or next year. Or tell the banker, wait till later so I can figure out what I have to make decisions for next year. They know that when the crops need to be harvested, the work needs to get done now. Well, we have 19 days left. This is day 20. We're going to count it down every day, because we have got to get this done in the House of Representatives. We did our job in the Senate. We did it on a bipartisan basis. I was very proud to join with my colleague, Senator Roberts, and all of our committee that worked so well together, worked so hard on this. And I thank again the leadership on both sides of the aisle for giving us the time to get it done. We got it done. We did it in enough time to give the House to do it in July before the August break. That didn't happen. Now it's time to get it done. The House Agriculture Committee did their job. It's time for the House Republican leadership to schedule a vote to get this done, to support rural America, our farmers, our ranchers, our families who are counting on the safest, most affordable food system in the world to be able to continue. We don't need to kick this can down the road and create another crisis for farm country. Thank you very much. Madam President, I want to thank my colleagues who are waiting to talk about another very, very important subject. I appreciate their giving me the time for a few words.
Madam President, would the Senator yield?
The Senator from Iowa.
The Senator yield.
I would be happy to.
Madam President, I just want to compliment the Senator from Michigan for her great leadership on agricultural policy, food policy. A big part of this bill is making sure that our kids in America get adequate nutrition, that our elderly get nutrition, our summer feeding programs, our after-school programs, our senior feeding programs are all wrapped up in this bill, too. I was in Iowa in August and met with a lot of farmers in August, and they were a little perplexed. They said, wait a minute, you passed a bill in the Senate. I said, yes. I asked the Senator from Michigan, did not that bill have the support of all the major farm groups?
Absolutely. We had not only farm groups, conservation groups all across the country.
I asked the Senator from Michigan, did not your bill, the bill you engineered and got through here, did it not also have the support of consumer groups and parent groups?
Absolutely.
They had all that support?
Absolutely, and because of your wonderful work on our school nutrition efforts, the Fresh Fruit and Vegetable Program,
sure,
the strong support from families, educators, schools across America.
Conservation groups supported the bill?
Yeah, absolutely.
So what farmers asked me, Madam President, was, well, wait a minute, if you had a bill that passed the Senate bipartisan, supported by all the major farm groups, supported by consumer groups, supported by conservation groups, well, why didn't the House just pick it up and pass it? I didn't have an answer. Does the Senator from Michigan have an answer? Because I don't understand why the House can't just take a bill that's so widely supported and such a bipartisan bill and just pass it.
Well, the distinguished senator is absolutely right. We would think that this would be the time to just pass it. And frankly, if not, we know the House committee has a little different view on commodities. We offered to sit down all through of August and be able to work that out so we could come back right now and come up with something that was a compromise. The House committee wasn't able to do that because they don't have support of the leadership to be able to get that done. And so here's where we are. What I know is we have to have movement. We have to have the House act, or we are not going to be able to get this done.
Well, you know, I say to my friend from Michigan, my leader on agriculture policy, that, you know, there's enough anxiety in farm country right now because of the terrible droughts that we're having around the country, shortages looming, and now is not the time to add more anxiety to farmers and to farm families in our rural communities across America. So I thank the Senator for her great leadership and for pointing out that she's acted, our committee's acted, our Senate's acted, and what the House is doing, I just can't figure it out. And again, I compliment our chairwoman of our committee and for pointing out we got 20 days left and we're counting down, and I'm hopeful the House will hear the voices of our farm country and the bipartisan voices here in the Senate and get our bill passed in the Senate. I thank the Senator from Michigan.
The Senator from California.
Madam President, I ask unanimous consent that when I'm completed, Senator Harkin get the floor at that time.
Without objection.
Madam President, I want to thank Senator Harkin because he and I were spending a little time together in your great state, and he and I agreed that one of the issues that ought to be talked about a little bit more involves the stark choice that we're facing in November, in large part due to the budget of Paul Ryan, who is now the vice presidential nominee for the Republicans. And Governor Romney has endorsed and embraced the Ryan budget, and I think, and it was Senator Harkin's idea, that we ought to explain that Ryan budget. So I'm going to do my best to talk about it as the chairman of the Environment and Public Works Committee, who has the jurisdiction of highways, bridges, transportation systems, and the environment. And also just make a couple of comments about Medicare, and I know Senator Harkin's going to go into that in great depth. I just want to make sure everybody understands that what I'm talking about comes straight from the budget. So if you look at page 78 of the report accompanying the Ryan budget resolution, Mr. Ryan makes it clear that he wants to make devastating cuts to transportation. Now, what do I mean by that? I mean devastating. I mean 50% cut. That means about 1 million jobs that would be lost, Madam President, if that Ryan budget were to go into effect. We're talking about construction jobs. We're talking about an area that has been hit so hard. We still haven't come back from this recession, and it's the one thing we learned in your great state at that convention was the depth of this recession, the worst since the Great Depression. And what a time Paul Ryan picks to bring devastating cuts to the construction industry, and I mean by that the businesses, because we are talking about mostly jobs in the private sector, not the public sector. And we have to think about the fact that 70,000 of our bridges are deficient, and 50% of our roads are not in good condition. So we're not only, we know bridges fail, we've seen it happen, we're not only talking about devastating cuts to construction industry and workers, but a devastating situation for people who use our bridges, the 70,000 of which are structurally deficient, and our roads which need help. So no country can lead the world if we can't move people and goods, and we cannot be a world power. And yet when it comes to transportation, the Ryan budget is a jobs killer. I'm talking about 1 million jobs would be lost in the private sector mostly, and he would put our family at risk by neglecting our bridges, our highways, and our transit systems. Now, President Obama, on the other hand, and frankly, a lot of us here on both sides of the aisle reject that notion that we can walk away from rebuilding our infrastructure. So this is a very, very key issue. Now, I said I speak to you as the chairman of the Environment and Public Works Committee, and I've talked a little about public works. What does the Ryan budget do to the environment? Now, what he does is he undermines the public protections, the health protections provided by the Clean Air Act, the Clean Water Act, the Safe Drinking Water Act, and other landmark laws. If you look at page 13 to page 15 of his budget, you'll see that he cut $62 billion for activities like protecting our drinking water, protecting our air, preserving our public lands. Let's face it, when kids get asthma, when people are too sick to go to work, when children are too sick to go to school, and when people die prematurely from a heart attack because of the air quality, there are no real savings. He says he's cutting $62 billion from the budget. Let me tell you, for every dollar you spend on clean air protections, we know we get $30 worth of benefits. In 2010 alone, the Clean Air Act prevented 160,000 premature deaths. You ask a family that may lose the breadwinner in that family, did we save money? No. 1.7 million asthma attacks, 130,000 heart attacks, 86,000 emergency room visits, 13 million lost work days, and 3.2 million lost school days. In 2010, the Clean Air Act prevented all that. So what's the point, Mr. Ryan? What's the point? It will cost the American public dearly, out of their pocket and out of their lives, if they suffer more asthma attacks, emergency room visits, lost work days, school days lost, more heart attacks, and premature deaths. That is short-sighted. The American Lung Association, they're not Republican or Democratic. They say 40% of our population lives in areas with unhealthy levels of smog or toxic soot. So let's remember, when you look at a budget, it is a set of values that accompany the numbers. And I don't think it's an American value to say to our people, we don't care if they get sick, they miss work, they go to the emergency room. Finally, I want to just set the stage for Senator Harkin's very in-depth discussion about health care. I'm just going to talk about Medicare and Medicaid as someone who is privileged to represent, along with Senator Feinstein, the largest state in the Union, the most senior citizens. We have almost 38 million people. So whenever we talk about this Ryan budget and how many people get hurt, believe me, I speak from the heart when I say we can't let it happen. The American people know Medicare, they like it, and they don't want to change it. Now, the Republicans tell you their plan saves Medicare. But just ask someone who's going to be the victim of a Paul Ryan plan if we don't stop it. That person will find that they're getting a voucher. They're not getting Medicare. Medicare will be gone. They'll get a voucher, and experts tell us, and the studies show, that voucher will be $6,000 a year short. And imagine an older person who really is struggling for a quality of life, having to have that added worry of not knowing if she will find or he will find health insurance. Look, putting Republicans in charge of Medicare is like putting the Cookie Monster in charge of your favorite bakery. And I'm not overstating it. You would not put the Cookie Monster in charge of your favorite bakery. Well, we can't put the Republicans in charge of Medicare. And I want to prove why. This isn't just rhetoric. Listen, in 1995, Newt Gingrich said he thought Medicare, in his words, should wither on the vine. In his 1996 presidential campaign, Senate Majority Leader Bob Dole bragged, quote, "I was there, fighting the fight, voting against Medicare, because we knew it wouldn't work in 1965. Really? Really? Medicare works. Why would we end it? We're not going to end it, but Paul Ryan gets into power, he'll have a good chance of ending it with his friend, presidential candidate Mitt Romney, who has endorsed the Ryan budget. Listen to what Michael Steele said, the head of the Republican National Committee in 2009. Quote, "I mean, the reality of it is this single-payer program known as Medicare is a good example of what we should not have happen." So, Ryan budget, look at page 53, shreds Medicare. Shreds Medicare. And I will tell you this, as if he hasn't slammed Medicare enough, look what he does to Medicaid. He cuts it by more than $800 million. And where are low-income families going to go? And again, Senator Harkin is the expert, but I can tell you this, so many of our elderly rely on Medicaid for nursing home costs. I will tell you, it is a disaster. And we know that in addition to all of this, these terrible cuts, and by the way, when Paul Ryan says and attacks President Obama for cutting money from Medicare, what he isn't telling you is the president has found savings from overpayments to providers, and you know what he does with the money? He puts it right back into Medicare, extends the life of the program for 8 years, closes the donut hole to help seniors, and gives senior citizens preventive health care, well checkups and the like. So really, that does take, to quote President Clinton, a lot of brass. Because the fact is, President Obama has strengthened Medicare, he's extended the life of Medicare, and what Paul Ryan does is he takes those cuts and he gives tax breaks to millionaires and billionaires. I'll yield to my friend.
I thank the senator for yielding, and I thank the senator for her keen eye on the Ryan budget and what it does. I listened to the senator's explanation of Obama. President Obama's goal was to cut down overpayments and things like that, fraud, abuse, put that money back into helping beneficiaries. I asked the senator, isn't it true that both Ryan budgets incorporate those very same cuts that President Obama wants to do?
Absolutely.
In both of his budgets.
Absolutely. Both of his budget takes the same amount, but instead of putting it back into Medicare, he robs Medicare, and Medicare will go broke. My understanding is in 2014 under the Ryan plan, whereas President Obama puts the money back into Medicare, extends the life 8 years, and gives more benefits.
I think the same.
So I'm going to finish up and just say to you this. However you look at this Ryan budget is a roadmap for disaster for the American people. He cuts the heart out of things the American people like. The American people want clean air. They want safe drinking water. They want Medicare. They want to make sure our seniors can be safe in nursing homes. The American people want transportation, and they don't want to be worried if a car is on a bridge, it's going to fall down into the water below. It's happened. And here's the deal. If you were to say to Mr. Ryan, are you cutting all this so that you can balance the budget today? He would say, oh, no, 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 that's 25 years from now. What is he doing with the savings, quote, unquote, savings? He's giving these huge tax breaks. Listen, and I'll close with this. People earning more than $1 million a year are going to receive $400,000 more in tax breaks every year. So he cuts everything to give these tax breaks to the people who already have millions and billions, but it's still not enough. As President Obama has pointed out, he will then have to go after the middle class and take away middle-class tax deductions like the home mortgage deduction. Because he doesn't even get enough money from these draconian cuts, he has to go ahead and raise taxes on the middle class. I watched presidential nominee Romney be asked this question. What are you going to cut? What? He said, we'll discuss it later. And Mr. Ryan said, the vice presidential nominee for the Republicans, we'll work with Congress on it. Right. Listen, they know they have to make draconian tax increases on the middle class and the working poor. They have to cut the things America wants in order to pay for their tax cut. No wonder Mr. Romney picked Mr. Ryan. Mr. Romney will get less than a 1%. He'll be in a 1% tax bracket. That's what the experts say. Can you imagine? While his secretaries and everybody else pays through the nose. So this is an important time for us, these next 60 days or so. And I want to thank my friend from Iowa because I was very interested in laying out some of these issues, but he encouraged me to do so. I'm very delighted to be here with him, and I yield the floor.
The senator from Iowa.
Madam President, let me thank my colleague, Senator Boxer, for always being on point and for always being very eloquent in her focus, in her exposition, I would say, of the fallacies of the Ryan-Romney budget and how it's going to affect our middle-class families in the future. Madam President, since we recessed here around the 1st of August, I guess it was, since we recessed and we have been out of session, Congressman Paul Ryan, our colleague in the House, has become the vice presidential nominee of the Republican Party. And, of course, Mr. Romney has accepted the nomination to be president. Well, now, And Mr. Ryan, Congressman Ryan, is not an unknown quantity. He's been here quite a few years, and he has put forward, as the head of the Budget Committee, a couple of budgets. Now, budgets are blueprints. You know, if you're going to build a building or a house, you need a blueprint. If you're going to try to move the country in a certain direction, you need a blueprint, and that blueprint is a budget. So a budget sort of tells you where it is that the proponent of that budget wants to take us as a country, a federal budget. If it was a state budget, you'd say, well, that's where they want to take the state. And so we, on this side, intend over the next several days, or a couple of weeks, however long we're in session, we intend to let the American people know what's in the Ryan budget and where it would take America. What is the blueprint that they have for America? Madam President, before I go any further, I want to ask unanimous consent that Mac LeBoon and Latimer Geek of my staff be granted 4 privileges for the duration of today's session.
Without objection.
I ask that request appear before I started my comments and that my comments appear uninterrupted.
Without objection.
So, Madam President, our nation faces an absolutely fundamental choice. In November, are we going to rescue, restore, and rebuild the struggling middle class in this country, or are we going to continue to shift even more wealth and advantages to those at the top at the expense of the middle class? Republicans have made it very clear where they stand on this critical choice. They did so when nearly every Republican in Congress voted in favor of the Ryan budget plan. And Governor Romney embraced that plan as, quote, marvelous. Marvelous. Well, not exactly a word that most average Americans would use to describe something they like, but I guess if you're having tea at the Ritz, I suppose marvelous kind of fits it for some people. But anyway, he embraced the plan as marvelous. Well, the very centerpiece of the Ryan budget is a dramatic shift of even more wealth to those at the top, huge new tax cuts for the richest 2%. The senator from California pointed out if you take the Bush tax cuts and extend those, which Mr. Romney would do and Mr. Ryan's budget does, then add on to it the tax cuts in the Ryan budget, which Mr. Romney supports, so I can call it the Romney-Ryan budget or the Ryan-Romney budget. If you do that, if you make over $1 million a year, you're going to get nearly $400,000 a year in new tax cuts. Think about that. That takes your breath away. $129,000 in the Bush tax cuts would be extended, plus an additional $265,000 that would be in the Ryan budget. Now, you know, Madam President, we hear a lot about entitlements. They're going to cut entitlements, and I will refer to that more in my continuing remarks. But this is an entitlement. Think about it. If you make over $1 million a year, you're entitled to that. You don't have to do anything else. Don't have to jump through any hoops. Don't have to show any hurt, anything else. It's just if you make over $1 million, you're entitled to it. How about this entitlement? You know, the Republicans always want to make it seem as though entitlements only go to poor people, or the elderly, or children. Now they talk about Medicaid as an entitlement. What about this? This is an entitlement to those who are rich. It's an entitlement. Well, so how do they pay for all this? How do the Republicans pay for all this? Well, they don't want to say how they do, but all you have to do is look at the Ryan budget, and that will tell you how they pay for it. They pay for it by massive cuts, draconian cuts, to programs that undergird the middle class, essential to the quality of life in this country, like education cuts, student grants and loans cuts, law enforcement cuts, clean air and clean water cut, food safety cut, medical research cut, highways, bridges, and other infrastructure that was focused on by the senator from California, cut. Cut. All those would be cut. The Republican plan would end Medicare. It really would. Now, people say, well, it would end Medicare. As we know, it would end Medicare, period. It would turn it into voucher care. So now we have a new word, not Medicare, but voucher care. That would force seniors to pay nearly $6,000 more per year out of pocket for their health care in future years. I'll explain that later. Voucher care. You get a voucher. You don't get Medicare, you get a voucher. Well, that plan would strip tens of millions of Americans of their health care coverage, cut millions of poor kids from nutrition programs. Their plan would leave America with a less skilled workforce, a deteriorating infrastructure, making us less competitive in the global marketplace. Now, lastly, Republicans offset these big new tax cuts by actually raising taxes on the middle class. Now, that's a dirty little secret that you won't find unless you dig into the Ryan budget. It's true. It's true. Now, here's why. Under the Republican plan, under the Ryan-Romney budget, middle-class families are net losers, paying significantly higher taxes. The wealthy are huge net winners. The Nonpartisan Tax Policy Center estimates that under the Romney-Ryan budget, middle-class families with children would see their taxes go up on average by more than $2,000 a year. And the bottom line is that the Romney-Ryan budget does not reduce the deficit. You know, I hear Congressman Ryan out there talking on the stump and Mr. Romney about the budget deficit and the deficit, and they go on and on. Why don't they own up to it? The Ryan budget keeps us in a deficit for 28 more years. Yes, you heard me right. The Ryan budget keeps us in the red for 28 more years. Now, when President Clinton was inaugurated in 1993, January 1993, and we put through the Clinton budget, which I might point out not one Republican supported, it turned those deficits right around, and within, what, 5 years, 6 years, we were in a surplus. It doesn't take 28 years. We took a Democratic president and a Democratic Congress passing the legislation in 1993 to end the slide into deficits, turn it into a surplus in only 5 or 6 years. Ryan budget keeps us in a deficit for 28 years. Again, the savings that they gain by slashing spending, raising taxes on the middle class, go to partially offsetting the $4.5 trillion in new tax cuts, most of which goes to the wealthiest Americans. The truth is, Representative Ryan is not interested in balancing the budget. That's not his interest. Even under the most rosy assumptions of his, as I said, the budget would not balance until 2040. The reality is, the Ryan budget overriding goal is not to balance the budget, but to reduce taxes on those at the top. Congressman Ryan has turned out to be a true acolyte of former Vice President Cheney, who famously said in an unguarded moment, quote, "Deficits don't matter." Remember that? Vice President Cheney, deficits don't matter. Well, I guess they didn't to him and President George W. Bush, because look at the deficits they plunged us into. And now Congressman Ryan is basically, with his budget, he won't say it publicly, but with his budget, he's saying the same thing. Deficits just don't matter. What matters, tax cuts to the wealthy. Now, Mr. President, never in our history have we seen a budget proposal so radical and extreme so radical and so extreme. Now, I was here, I was in the House and then later in the Senate when President Reagan was president. Now, he was conservative, but he wasn't radical and as extreme as this budget. This is, when I tell people back in Iowa about the Ryan budget, they say, come on, that approach is so extreme and unbalanced, you must be making it up. Well, Mr. President, the Romney-Ryan plan is extreme and unbalanced, and I'm not making it up. Don't take my word for it. Listen to former House Speaker Newt Gingrich. He criticized the Ryan budget. He called it, quote, right-wing social engineering, end quote. Well, all I can say is, Newt, you got that one right. Mr. President, Representative Ryan believes in radically shrinking the size of government to what it was over a half a century ago. His aim is to use the deficit crisis as a pretext for degrading and dismantling everything from Medicare and Medicaid to education, environmental protection, workplace safety, medical and scientific research, and on and on. And it doubles down, as President Clinton said, it doubles down on the theory that if we just give more and more of our national wealth to those at the top, it will magically trickle down. We've tried that before. It sure doesn't work. Now, I'd like to focus some more of my remarks this evening on the devastating impact of the Romney-Ryan budget on Medicare and Medicaid, but health care more generally. Now, since he first arrived in Congress, Representative Ryan has consistently pushed a very radical health care program to end Medicare, as we know it, but to go to a voucher care, give everybody a voucher. Well, under his proposal, seniors would no longer have the guaranteed Medicare benefits that they've enjoyed for decades. Instead, they would get a voucher from the federal government, and they can go out and buy individual private insurance or Medicare. Well, now, that's the catchy little thing. You'll hear Mr. Ryan and Mr. Romney say, well, they can buy Medicare if they'd like it, or they can buy private insurance. Now, let's look at that. They say this is a tough-minded solution to our debt problem, but it's just a scheme to shift costs onto America's seniors rather than making debt reduction a shared sacrifice for all of us. So again, let's look at this voucher system. They would get a voucher program. Senior could buy traditional Medicare or health insurance. So what's the catch? The voucher won't be enough to cover health care costs. So seniors' out-of-pocket health care costs will steadily increase. The nonpartisan Congressional Budget Office has projected that the Ryan budget proposal could increase annual out-of-pocket costs by seniors by more than $1,200 in 2030 and $6,000 in 2050. Now, what this chart shows is the increase in health care costs in today's dollars, constant dollars, that an elderly person will have to pay for during their expected life, their average life expectancy from the time they retire. So in 2023, the average senior living an average lifespan would pay $59,500 more. Senator Boxer rounded that off and said $60,000 more. But look what happens when you get to 2030. The average senior will pay $124,600 more over their expected lifespan. 2040, $216,000 more, and by 2050, $331,000 more for the retirement years that they would have to pay in health care costs. And that's in constant 2012 dollars. Well, okay, you say, well, but a senior can go out and buy traditional Medicare or private health insurance. Now, here's the catch on that. What you do is you put Medicare in a death spiral. Here's how. If you're a very healthy senior, you can go out in the private insurance market and probably get a pretty good deal. You know, you have no pre-existing conditions, you've never had cancer, no one in your family's had it, you're very healthy, you've never smoked, you know, and you're just in great physical shape. You can probably go out and get a cheap private insurance policy with your voucher. So what stays in Medicare then? The oldest and the sickest. And therefore the costs of Medicare spiral up and spiral up and becomes untenable. It's a death spiral. That's Mr. Ryan's way of killing Medicare. Oh yeah, he says, oh, get a voucher, you can buy Medicare or you can buy private insurance. But it puts Medicare into a death spiral. The Ryan budget turns this successful, reliable, comprehensive source of health care that seniors have relied on for decades and have paid into, I might add, during their years of hard work, into some unproven, unpredictable, right-wing conservative experiment. Well, I don't want to experiment with the elderly. I want them to have good health care that they can afford, that's universal, and that they can count on. President Obama has fought to strengthen Medicare, and he believes, as we do, that it's a sacred contract. And he's made a commitment to strengthen Medicare and the Affordable Care Act. For example, by eliminating the gaps in coverage, closing the donut hole, which we've already started to do. Elderly Iowans this year, I think, got over $600 back this year just from closing the donut hole. Reducing the cost of prescription drugs. According to Medicare's own actuaries, the Affordable Care Act, Obamacare, extends the program solvency from 2016 to 2024. Again, how? Well, as the senator from California said, by fighting waste, fraud, abuse, and by getting rid of wasteful subsidies to insurance companies. So our plan for Medicare is basically summed up, mend it, but don't end it. Now, I was taken a little aback yesterday. Over the weekend, Governor Romney stated he would keep some of the popular provisions of the Affordable Care Act. Like what? Well, like kids staying on their parents' insurance plans till they're 26, ensuring coverage for folks with pre-existing conditions. Well, I said, well, wait a second. I thought he said on the first day he was going to repeal Obamacare. But now he says he wants to keep them. Well, I was a little confused, but my confusion was short-lived because his campaign then came out with a clarifying statement. They clarified what Governor Romney said, and this is the quote. Quote, Governor Romney will ensure that discrimination against individuals with pre-existing conditions who maintain continuous coverage is prohibited, end quote. Well, the Washington Post reports that 89 million Americans would be left out of Romney's pre-existing condition plan. Why? Well, they were working and they had a health plan. They were out of work for a month or two, maybe went someplace else to work, got a different plan. Sorry, you didn't have continuous coverage. You don't get covered. These are the little games that Governor Romney and Congressman Ryan are playing with the American people.
Would the senator from Iowa yield for a question?
I'd be delighted to yield to my friend from Illinois.
I was trying to understand this Republican position. It used to be crystal clear. 23 debates, we heard the Republican candidates say, one after another, first day in office, Obamacare is gone. But I heard the same thing you did, and I tried to understand it. Now, I do give Governor Romney some credence in this regard. I've said, when asked, he is the baby daddy of Obamacare because it was Governor Romney who created the first version of Obamacare in the Commonwealth of Massachusetts. And he understood, and I hope the senator from Iowa can help me to understand, and those listening, he understood the concept of insurance. if everyone who bought an insurance policy wrecked their car or got sick the next day, insurance wouldn't work. The only way it works is most people are safe drivers. They buy insurance and a small percentage use it. So there's a pool of money collected from premiums, creating a reserve for accidents. So here we have a situation where Governor Romney has agreed with us, I commend him, that people with pre-existing conditions, when it comes to health care, should not be discriminated against. But the senator from Iowa, as chair of the committee that dealt with Obamacare, knows what adverse selection means. It means that if you wait until you're sick to buy your health insurance, the whole system falls apart. And so, in Massachusetts, they required everybody to buy health insurance.
I think that's called an individual mandate.
Individual mandate, some of the critics might say. We call it, some of us, individual responsibility.
Right.
And we did the same when it came to health care reform. Keeping in mind, if you currently have health insurance, like your doctor, like your hospital, we're not going to change your life one bit. But for those who are out in the marketplace, the availability of health insurance will be there, but everyone has a responsibility to buy it. We don't think twice when we have a closing on a home when they say, now you need fire insurance on this home. My home's never burned down, thank goodness, but I buy fire insurance, individual responsibility, so there's somebody to pay if the mortgage, pay the mortgage off if the house burns down. But in this circumstance, what I understand Governor Romney to say is, we don't think insurance companies should discriminate against people with pre-existing conditions. Okay, I'm with him. But then he goes on to say, I think the point that you've made, let's kind of bear into this for a minute. What he goes on to say is, so long as you have had continuous insurance. Well, what if you were unlucky enough to lose a job? Out of luck. Your pre-existing condition just disqualified you from health insurance. You're stuck. That's right. Under the Romney approach. What if, you had any kind of interruption, whatever, in your insurance coverage? You're dead in the water. So when we talk about taking uninsured people, bringing them into insurance that has quality to it, quality coverage, where you can't discriminate against people, we're saying whatever your previous insurance experience, we're all going to get in this together. We're all coming under the tent together, and you can't be discriminated against because you're a woman, had a baby, all the different things that they've used. So when you listen closely to it, here was Governor Romney basically saying, I'm against the discrimination on pre-existing conditions, but, and then footnote down at the bottom of the page, as long as you have had continuous coverage. It's an empty promise. It doesn't give you anywhere near the protection and assurance that Obamacare gives. That I understand to be the difference. Is that the way you understand Governor Romney's clarification of his statement of yesterday?
I thoroughly agree with my friend from Illinois, Mr. President, that, Governor Romney makes this statement. It's on a very popular, well-viewed Sunday talk show, Meet the Press. And so the average American says, oh, Governor Romney, he's for keeping coverage for pre-existing conditions. Yeah, well, that's good. Well, that's nice to know. They don't hear the clarification that came about later, because that was not on Meet the Press. That was sort of under the radar screen when they said that they wanted to clarify it, that Governor Romney, what he meant was that he would ensure that discrimination against individuals with pre-existing conditions who maintain continuous coverage. As the Washington Post pointed out, there's 89 million Americans out there that would be disqualified because they had a plan, they lost it, as the senator said, they lost their job or they moved or something like that, picked up another plan, there goes your coverage. Just think about that. You're a family. Let's say one of your spouse has a pre-existing condition. It could be diabetes, it could be cancer, it could be anything. You bet you've been covered under a plan. What President Obama, with the Affordable Care Act, Obamacare says, beginning in 2014, just as we now cover children, beginning in 2014, no plan can discriminate against you because of a pre-existing condition. Under what Romney is saying, with his clarification is, only if you've always had that plan. Now, what if you're a family and you've moved from one state to another? That's where the job is. You move. Your spouse, maybe one of your children, maybe who's still on your policy, has had a pre-existing condition. They won't cover you. They won't cover you. But Mr. Romney didn't say that. He didn't say that on Meet the Press.
I asked the senator from Iowa, have you met people in your state? I've met some in Illinois who said to me, I cannot leave my job. Cannot leave my job.
Right.